With Congress at work on a replacement for Obamacare, there is more urgency about changing the formula for health coverage in Massachusetts. The state's a leader in access to coverage, but there's still concern about access to care and even more so about the costs. Among those with ideas for changes is the senior fellow in healthcare at the Pioneer Institute. She's also an associate at the Harvard Kennedy School and the state's former undersecretary for Consumer Affairs and Business Regulation. We'd like to welcome Barbara Anthony. Thank you very much for being with us.
Thank you, Chris. Thanks for having me. It's great to see you again.
I want to start out with Medicaid because this is one of the things that makes Obamacare possible throughout the country. And now the Trump administration is saying we've got to cut Medicaid big time. So what does that mean?
Well, first of all, I'm going to use a very technical term now. This is crazy, okay, to be cutting Medicaid in the way in which the president has proposed, or even the House in the American Health Care Act proposed. But the president's proposal, I think, is even more draconian than that. Look, in Massachusetts, we accepted the Medicaid expansion, and in this state, we are down to an uninsured rate of about 3%. So that's about 270,000 people out of 6.8 million who are uninsured. It's the smallest in the nation. You know the saying, there's no such thing as a free lunch. Well, there's no such thing as free health care either. And we do spend a lot of money in Massachusetts on Medicaid. I think it's 40% of our budget, and that is a lot of money, and we have to contain costs in that program. But the cost of not covering people who need health care access, well, we've lived through that. We know what that means. That means that emergency rooms are overwhelmed, that you get your care at an emergency room, which is really not good health care. There's no continuity there. People with chronic diseases come back over and over again. I mean, we're going to pay one way or the other. And so this talk about cutting Medicaid, these plans about cutting, I think that they are they're bad public policy, because at the end of the day, we all end up paying, and I think the sooner we realize that, as I said, no free lunch, no free health care. So here in Massachusetts, there are some things that I think we need to be looking at in terms of the Medicaid program, because we do have something like almost 2 million people out of our population on Medicaid. Now, a lot of those people are low-wage earners who actually work for big companies. Now, those companies offer insurance, but the wages for those workers are too low for them to be able to afford the coverage that their employer offers. So what can we do? Well, it's been proposed, and this has been proposed by Dr. Torchiano, who is the CEO and president of Partners Healthcare. I'm not going to steal his idea. I want to give him credit for it. That those employers whose low-wage workers are on Medicaid, they should be assessed maybe $4,000 or $5,000 a head for each of those workers. Put that money into Medicaid. Otherwise, it's it's just the taxpayers who are paying for it instead of the employer offering the coverage, but the workers can't afford it. That's one thing.
I'm curious, is there a trend going on here of more employers dumping out of sponsoring plans now that we've had Obamacare these past few years, or is there something just holding on that?
Well, that's a good question. I don't think anyone really knows the answer. I haven't seen data that says to me, yes, employers are purposely dumping their employees. I think what's happening is what I just said. Employees, first of all, our state population has grown. We used to be a state with a declining population. That's no longer the case. We almost have 7 million people here now. It was just about 10 years ago, we were like 6.2, 6.3 million. So we're a growth state in that sense. And I think what's happening here is that low-wage workers can't afford the premiums. So with the Medicaid expansion, you can enroll in Medicaid, and you'll either get it for free or you'll have to pay some kind of premium, and you get subsidized. So I think that's one of the things that's going on here.
This is BNN News, and we're talking with Barbara Anthony from the Pioneer Institute. Barbara, one of your associates at the Institute pointed out that the rate of Medicare enrollment in Massachusetts is comparable to West Virginia. So here is, you got a fairly prosperous state that we live in, and we're very similar to West Virginia in this one respect. I mean, should that be the case?
Well, we have a lot of low-wage earners here. You know, we have had a lot of wage stagnation, not just in Massachusetts and West Virginia, but throughout the country. Let's remember that great recession that we had from about 2006, 2007 to about maybe 2014. That really took a whack out of us in terms of wages. So there are a lot of low-income people here. And I don't really know right now off the top of my head whether West Virginia took the Medicaid expansion or not, but we did. And that meant another 300 to 500,000 people who were then eligible for mass health. That's what Medicaid is called here. Now, not all of it is all Medicaid, in other words, paid for by the government. Some of it is subsidized so that the individual, about 200,000 of those people, have to pay some premium, and then they get subsidized.
Of course, the other issue here is just what providers charge. We have some teaching hospitals, world-class institutions, but
Right.
they're pricey.
It's crazy. I'm going to use that technical word again, but it is crazy. We have price variations in this state that really knock your socks off. I'll just give you an example, if I can, Chris, because we did this sort of stuff at Pioneer, a study of MRIs, a simple procedure, and everybody knows what an MRI is, of your left knee. We called something like 22 hospitals around the state. We got down on the South Shore one price of, say, $600. $600. Come into Boston now, go to a major teaching hospital in Boston, a major academic medical center, $10,000. $600 here, $10,000 here, and everything in between. The price variation is ridiculous. Problem is people, and a lot of folks now moving away from the Medicaid population to the rest of us who are insured and have health care, we have high deductible plans. The first dollar is coming out of us, not the insurance company. We don't even know that we can shop for health care, for procedures. I'm not talking about an emergency, situation where you're rushed to the hospital. I mean, most health care procedures are planned. An MRI is planned. You have to make an appointment, put it in your calendar, so you can shop around, but we're not even aware of those variations. Now, why are those variations in price so much? Why are they so much? Because some entities, some providers, big hospitals in particular, have market power here. And they can demand, if you're an insurance company and I'm a high-price provider, you need me in your network, you're going to pay me what I want you to pay me, because you can't afford to tell your members, hey, we're not going to have XYZ hospital in our network because you may end up losing members. We've got to do something about that. We've got to bring the top down so that we call them unwarranted price variations, meaning that you can't explain them by cost alone or by quality. And that's a big issue, quality, because there have been many studies here in Massachusetts. And we're lucky in a lot of ways because we have very good healthcare quality here in the state. And you don't have to be a big academic medical center to deliver quality healthcare. And actually, the studies that have been done here have shown, for the most part, that community hospitals have about the same degree of quality health care that your large downtown hospitals have for most common procedures. So you can't explain these differences by quality. You can't explain them by the underlying costs. What's going on? Something else is going on in the marketplace here, and it's not competitive enough. Governor Baker actually threw out an interesting proposal recently. And what he was proposing, and it's a conversation starter, is that his proposal would prohibit insurance companies from paying over a certain amount in terms of a percent increase to certain providers. So if you're a huge provider with market power, the insurance company it's going to give you zero increase. Now, that raised a lot of hackles, of course, in the healthcare community, as I'm sure you can imagine. But it's a conversation starter. We've got to do whatever we've been doing so far, just is not bringing that top down, and it's making us still one of the priciest, if not priciest, in terms of healthcare costs in the country.